Hello everyone, Drew Watts here with Restorative Oxygen Care, and I'm here with our medical director, Dr. James Collier.
Hello.
And we're going to start a series of videos today regarding cancer. And cancer is something that has touched pretty much everybody. I don't know somebody who has not been affected by cancer in some shape, form, or fashion. And I personally have several friends that I went to high school with who have just recently been diagnosed with cancer, and some other friends as well. So it's obviously a topic that's very near and dear to my heart. But anyway, so we're gonna lead a little bit of a series in cancer-related videos, and in part how hyperbaric oxygen therapy can help treat cancer and some of the effects of cancer treatments. So Dr. Collier, explain just briefly, if you can, a little bit about the nature of cancer, and then we'll get into some of the specifics of how hyperbaric oxygen therapy can help treat those.
Okay. Cancer is a very complicated set of diseases. Cancer can form in almost any part of the body, and treatments vary widely depending on what is the origin of the cancer, the type of the cancer, the stage of the cancer when it is discovered. Your cancer therapy basically is in three parts, of which an individual patient may have one or all three. The first, of course, is surgery to try to remove the tumor and get the cancer out of the body, period. The second is what are called adjuvant treatments, which is radiation and chemotherapy to try to root out any cancer that may have escaped the surgical blade.
Okay, so everybody's heard of radiation and everybody's heard of chemotherapy. We don't often just think about just a surgical intervention necessarily. People usually, I think, associate a cancer treatment is going to be either or both chemo and radiation. Explain a little bit about what might be some of the complications, like a wound complication following, let's just say it's just a surgical intervention with no chemo, no radiation.
Sure. So a wound is a wound is a wound. If you have surgery for whatever reason, whether it's a malignancy or not, there will be a surgical wound created. Surgery is getting more and more inventive and sophisticated, so the wounds created by surgery are not as large as they used to be, but there are still some surgeries, particularly those involving the head and neck area, for instance, in which there are still large and convoluted wounds that are created and in which tissues are moved around in order to try to close the wound back up. Any of those wounds can become complicated by breakdown, which is even more likely in the case of patients who had cancer large enough or aggressive enough to actually affect their whole health. Their entire body has been degraded by cancer before treatment is even attempted. So sometimes you do get complicated wounds just because the body is not prepared to heal itself.
Gotcha. Okay. And so how then, again, we've done a wound video and a skin graft and flap video. For the people who this may be the first video they're seeing of ours, explain how hyperbaric oxygen therapy helps with complicated wounds or wound complications.
Right. Wound healing always comes down to, is there enough oxygen in the wound for healing to take place? And of course, oxygen gets to wounds through the vascular system, through the blood vessel system. And if those have become compromised for one reason or another, including cutting at surgery, then it's difficult for the body to get enough oxygen into the site where healing is actively going on. So hyperbaric oxygen addresses this in two ways. Number one, we put so much more oxygen in the blood that even if the blood supply is compromised, it's still bringing a useful amount of oxygen to the cancer site or the healing site. Second is that hyperbaric oxygen helps the body recreate small blood vessels to additionally facilitate getting blood into areas where more blood and thus more oxygen is needed.
Excellent. And so I think that's one of the most amazing things about just the nature of how hyperbaric oxygen therapy works is its ability to be able to heal these things, which have, again, for one reason or another, been complicated. We treat a lot of patients with diabetic complications, and
Correct.
That's another one of those things that if you have a cancer diagnosis and treatment, and you have diabetes, that sort of increases the risk that there
Absolutely.
will be some form of complication.
Absolutely.
Okay, excellent. So the next thing, next I guess form of treatment for cancer that people I think are very familiar with is going to be radiation therapy.
Right.
So explain a little bit about radiation, and then we'll get into how HBOT
Okay.
helps improve those.
All right. So radiation basically means bringing ionizing radiation onto a site where cancer is either known to be present or suspected to be present, in order to destroy cancer cells, which are more vulnerable to the ionizing effect of radiation than are our normal body tissues. But unfortunately, there's not a very clear, distinct line. So sometimes you do damage tissue that you want to live and thrive while you're trying to root out the cancer. And so that's where we can come in by trying to help recreate that tissue or to restore that tissue to a better state of function.
Gotcha. And some of treatment for radiation treatments have become and are getting much better and more effective. They're able to
Right.
more specifically target
Right.
cancer cells and cancer tissues
Correct.
and tumors. But just as you said, in many instances, there is some collateral damage to the healthy tissues,
Right.
and that is where the HBOT can really come into play, correct?
That is correct, yes.
Okay. And how does HBOT affect post-radiated tissues?
Okay. It's still the same thing as when we're treating wounds. It's the same principle. If tissue is trying to heal itself, it ultimately needs oxygen, which means that it needs blood. Of course, it needs a variety of nutrition, which is also delivered through the blood. Hyperbarics doesn't enrich the blood in terms of nutrition, only in terms of oxygen. But ultimately, actual blood has to come into the scene, and hyperbarics can help the body generate new blood channels.
Okay. And are there instances where somebody is undergoing radiation and the blood vessels that would supply those tissues can be damaged from the radiation? Is that also something that we might see every once in a while?
Yes, that's definitely what happens.
Okay. All right. Now the other side of cancer treatment that many people are familiar with is chemotherapy.
Right.
And so explain a little bit about chemotherapy, and then we'll discuss some of those other
So the
options.
principle of chemotherapy is very similar to the principle for radiation. You're trying to kill cancer cells which are more vulnerable to the various chemical agents that are being used than are the normal cells. But again, some chemotherapy can damage tissue you don't want to damage, but you can't help but damage it if you're going to actually eradicate the cancer. So it's basically a collateral damage, if you will. And the same principles apply, that you need to rebuild those tissues. Those tissues require oxygen, those tissues require blood, and that's what we're delivering with our treatment.
And that's what we're in the business of, right? Yep. And so I've spoken with a few oncology offices and who have mentioned that patients have developed a wound for one reason or another in the middle of their chemotherapy treatment.
Yes.
That's something that in that short term, obviously we can help treat that patient, right?
Right.
Because the goal is ultimately to get them back on their cancer treatment protocol and plan as quickly as possible and with as little damage as possible. Explain how something like that might look like if somebody had to stop their chemotherapy because a wound had developed.
Right.
Explain, this might be maybe even more for the providers who might see this, but how would we come into play in that type of scenario?
Okay. Radiation and chemotherapies both damage the body's natural immune system. Therefore, there is concern that a wound which is present is going to get worse rather than better while somebody is being subjected to radiation and or chemotherapy. So providers are typically hesitant to go ahead with radiation and or chemotherapy because they're afraid they'll make a wound worse. But again, HBO can help. It is a known adjuvant therapy for wound healing for the very things that we've been discussing. It's a way of getting more oxygen and more blood supply into areas that are attempting to heal. So if someone's cancer treatment is interrupted because there's fear that a wound will become significantly worse, you want to get that person healed up as fast as you can so that cancer treatment can resume. So hyperbaric does a pretty good job of accelerating wound healing.
Right. And so in those circumstances, as a wound develops, we may be able to get somebody in, get them treated in a more truncated, kind of shorter period of time, so they can then resume their normal cancer treatment, hopefully without any further damage as well.
Right. As a rule, these would be conjoined. The hyperbarics would be ongoing along with the resumed cancer treatment in order for the wound to continue its healing process in concert with the cancer treatment.
Okay. And one other thing, because I know we had this come up with a patient recently this summer, there are certain contraindications, for some chemotherapy drugs, right?
There are some chemotherapy drugs you cannot use in conjunction with hyperbarics. They just don't play well together.
Right. And so that's something that our medical staff is very, very in tune with, is making sure that if a patient has halted their chemotherapy, we want to make sure that those drugs are out of their system, essentially, if you will, for the necessary amount of time before they were to start hyperbarics, right?
Fortunately, that's not a terribly long amount of time, but yes.
Correct. But it is something that our medical staff is very aware of, and we pay attention to make sure that obviously patient safety and patient health and outcomes are taken into consideration, are number one priority for
Absolutely.
us. Okay. Well, thank you again, Dr. Collier. Again, this is the first video in our cancer series. Our upcoming series is going to delve into a little bit more specifically about some of the specific complications from specific cancer treatments, radiation for different parts of the body, and how hyperbaric oxygen therapy can improve, and in some cases we're hoping prevent those injuries from ever occurring.
Okay.
All right. Thank you guys so much. Tune in for the next in our cancer series video.